Hi, I'm Dr. Aditi Garg. I'm a maxillofacial surgeon. I have an experience of around 15 years and I practice at Elite Aesthetic and Dental Clinic, HSR, Bangalore. Let's talk about hair transplant procedure. It is a procedure where your natural hair is taken from the back and the sides of the head and it is implanted into the area where you have less or no hair. Now, there are two most common ways a hair transplant procedure can be done. It is FUT or FUE. FUT is Follicular Unit Transplantation procedure. It is also known as strip method. In this, a strip of skin is taken from the back of the head, then it is dissected and individual hair grafts are separated from it. In this procedure, there is increased scarring, increased recovery time. It is slightly more painful, but the advantages is that in lesser time you get more graft. The other method is Follicular Unit Extraction FUE method, which is most commonly done these days. In this method, individually grafts are taken from the same donor area. They are processed and cleaned and then these are implanted into the recipient area. Now, what is the process of hair transplant? The first and the most important thing is consultation. In the consultation, the doctor will assess what is the pattern of hair loss you have, how many grafts you would need, what are your expectations, what is the timeline you are looking for. Once the method is decided, then we plan the process of hair transplant. It starts with either shaving, which is normally done in males, and non-shave method, which is normally done in females. The donor area is selected, which is the back and the side of your head. Local anesthesia is given so that the process is painless. Once the anesthesia is there, the individually hair grafts are extracted with the help of small circular punch. Once the grafts are taken out, they are processed, cleaned and kept ready to be implanted. Next, the recipient area is prepared. After giving local anesthesia, slitting is done, which is basically making space for the hair grafts to be planted. The direction and the position of the slitting is important so as to give a natural appearance for the grafted hair, as well as to make them as dense as possible. Implantation, where individually these grafts are taken and implanted into these areas. There are two ways to implant a hair graft. It can be done with the help of forceps or it can be done with the help of implantor pens. The process of hair transplant takes around 7 to 8 hours. The patient is conscious, you can talk, you can take breaks, you can have your meals in between, and it is a well tolerated procedure. The success rates are pretty high. Now, what are the aftercare for hair transplant procedure? For the first 7 to 10 days, you have to take care of the recipient area. Spraying of saline is important so that the scabbing doesn't happen. The scars are less stretchful, they are less itchy. The donor area also needs to be cleaned daily with the help of an antibacterial ointment and saline. For the first 7 days, you have to ensure that you are not exposed to sun, rain as well as dust, because you can't really wash the area. You have to take the medicines which are prescribed by your doctor. Do not touch or scratch the area which is implanted. Ensure you're sleeping on your back. Avoid smoking alcohol and avoid things like steam, sauna, too much outdoor activities, heavy exercises. Mild walking and normal work is good enough. After 7 days, you start washing your hair on a regular basis with a mild shampoo. You can start taking your supplements. You can start doing minoxidil sprays from 15th day onward. You have to avoid swimming for 1 to 2 months. You have to avoid helmet use for 15 to 30 days. But you are good to go to your work. You can resume your activities. You can resume your work. It does not interfere with that.